want to add one thing that as a personal experience to me in Quebec. This is probably my lane, really, really in a good way today. Because in Quebec, I was raised with universal health care. That's the word for it, cliche, talking point, whatever. And for the most part, during those years, and I'm talking 60s and 70s for the most part, it was great, Val. We actually had a local doctor, and we went down with an appointment basis and stuff. And it was weird because, of course, I've kept in touch with folks back there, not only from when I went to school, but especially family members. And it was odd because I wanted to, and this wasn't long ago, but I wanted to find out about the healthcare in Quebec more recently, in the last few years or whatever. And I heard nightmares, Val. I heard nightmares. And I'll talk specifically. I had a relative who had two children, and she would never take them to the doctor, even if they were sick, just like that. I said, well, what are you talking about? Because at the time, and this is pretty recently here, Val. They had to, if one of her kids were sick, and it is sick, sick to the point of needing to go to the doctor, a flu or whatever, bad temperature, whatever, she would have to line up about 5 o'clock in the morning, hours before the facility opened, to simply get a place in line. And forget appointments. Again, this is one story, but it really bugged me. So I had to wait it for since like 5 o'clock in the morning to get an appointment. There was no appointments. It was still a clinic type of situation. And then once you got in, you'd literally have to wait again, like a clinic situation, till as late as she told me, like 5 o'clock in the afternoon. And then if they closed, they closed. I was stunned. So because of that, she doesn't take her kids to the doctor, Val. I have another friend in Montreal. Same thing. Where you don't even dream of going to an emergency room, because of the wait, and of course the wait, and blah blah blah. And so all I know is the stories I've heard. And you touched on here a little bit the state of affairs with Alberta healthcare. I pray. The easy answer is AB 51, or establish your own truly beautiful cradle to grave type of healthcare, very much like the quality of service you receive in the United States. People can say what they want about U.S. healthcare, but it's absolutely incredible. I can say that because I've gone through it. It's incredible quality. People, we've said on the air before, the United States won't allow their citizens to die. That's a broad statement, but there are no. Um, Oh boy, I won't say it. I won't say it. They're called, in the old days, these were called death panels, where patients in universal health care are too old, and they're too old, or at least becoming a real burden on the system financially. We've
Say
had
that
these.
again.
We've
Say
had
that
these.
again.
You got me going. I didn't think I was going to be talking politics today, Val.